So my name is Mark Gallagher. I'm a cardiologist.
Surgeon Mark Gallagher has COVID-19.
So it's now 8 o'clock in the evening. My son has just knocked on the wall of my room to tell me that he's left the food outside.
To protect his family, he's taking his isolation seriously.
So I've stuffed this gap with a t-shirt. The gap around the side of the door is much smaller. I have sealed that gap by folding up pieces of paper like this. And there's my dinner.
It's more like malaria, perhaps, than like flu. So don't be taken in by the flu comparison or the common cold comparison.
1 in 4 doctors in the UK are now sick or in isolation. Dr Gallagher's now finished his 2 weeks in isolation and is back at work as per the guidelines, but he's apprehensive.
There is some evidence that people can continue to shed the virus for much longer than 2 weeks after infection.
And highly critical of what he says is lacklustre government action.
They were fully alerted to the problem in the first week in January. So the response is still extremely disappointing. The response we've seen in several European countries, and I think particularly the UK and the Netherlands and Sweden, is shoddy, amateur, and just not proportionate to the extent of the problem.
One of the greatest concerns for medical staff here is the testing rates. The government had aimed for 25,000 a day, but admits it can't reach that figure until the middle of this month. In comparison, in Germany, where there's a relatively low death rate, they're testing 500,000 people per week.
The lesson has to be test, identify and isolate.
For now, though, they're still preparing for the worst. This convention centre in East London is now a 4,000-bed hospital and will begin taking patients by the end of the week. A sign things will get worse before they get better. Samantha Hawley, ABC News, London.